Okay, let's bring in our next guest, Dr. Art Mirelez. What's going on, brother? How are you?
Doing fantastic.
Yeah? How's things in the dentist world?
You know what? I can't complain. Things are going great. Things are going great. We're a lot of as long as there's sugar in this world and teeth in this world, we're doing okay.
No, I shouldn't say how's the dentist world. I should probably say how's the wellness world.
That's right. That's right.
Because you're in not just the mouth, but the whole body.
Yeah, you know, our approach to dentistry is definitely, I think, unique, and there's more and more dentists catching on to the wellness model. And whereas most dentists are in the repair model, and the repair model is basically if you have a tooth that's broken, you fix it. If you have a space, they fill it. And so they're constantly just repairing things as things occur. In our practice, we take the wellness approach where we're looking at the patient as a whole, their entire body, because we understand the ramifications of having an unhealthy mouth and how it affects your systemic health.
People don't think it's weird when they go to the dentist and you say, drop your pants?
Well, we always ask that after we ask them to open their mouth. No, I'm joking.
Just thought I'd ask. It struck me as a little different.
Yeah, we work between the nose and the chin.
Okay. So the mouth has a lot to do with other parts of the body, though.
Exactly.
Tell me about that.
Well, there's more, I mean, every day there's more studies just showing that the health of the mouth is related to the health of the body. In fact, recently they showed that if your mouth is unhealthy, then your diabetes is at risk of being worse. So there's something.
How does that work?
Well,
there's diabetes is prominent here in the valley.
Yeah, it's prominent across the nation. I mean, it's really, really huge. And so what happens is we all have bacteria, and they affect us in different ways. Some of it is good bacteria, some of it is bad bacteria. When it gets into our bloodstream, it really creates inflammatory processes. And so when that inflammation builds up, normally, a person that's in good health, we can handle those things. But if you're a diabetic, you're at risk for multiple, problems because your body doesn't have that immune system that it normally should have. And so what we find is that when you have gum disease specifically, that your hemoglobin A1C, which is a marker of the blood sugar levels over the past 3 months, so that hemoglobin A1C, when there is gum disease, it goes up. Once you clean up gum disease, that hemoglobin A1C comes down without any other changes. So you don't change your exercise habits, you don't change your eating habits. All we're doing is just cleaning up the chronic infection that's in your mouth.
I'm looking out across the audience. Not one person has their mouth open. Everyone says all tight-lipped over there.
I could do some free exams right now.
No, hey, that'd be great. Now,
no, but studies show that about 50 to 70, the studies range, 50 to 75% of the population in the U.S. has gum disease. So that means half of these people here at least have some sort of gum disease. And a lot of people don't even know
why is that?
You know why it is because I never really understood this, but think of it this way. If your finger was bleeding, what would you do?
I would put a Band-Aid on it.
Yeah, you would get some help, right? You would help yourself or you go seek some help. Now, what if every time you grabbed your phone, it started bleeding? What would you do?
I'd probably would
it'd
get
be
rid
really
of it really
weird,
fast.
Right?
Yeah.
So why is it that when every time we brush, our gums bleed, and we're just like, no big deal. So my thing is that when there's bleeding outside of the mouth, it's a big deal to the human. But when it's bleeding inside the mouth, it's like, oh, that's normal. But it's not normal. It's not normal to have bleeding gums. If your gums are bleeding every time you brush, it's a sign of gum disease. And so that's some of the messages that we send to our patients, that we can't ignore things that are going wrong. Especially, people. I get patients every day, Chuck, that says, well, doc, it doesn't hurt. And I say, well, you know what? Diabetes doesn't hurt. Cancer doesn't hurt. When a stroke is coming on, it doesn't hurt. But you address those things. And so we kind of really try to bring people to the understanding that just because it doesn't hurt doesn't mean that you don't address it, And so we really encourage our patients to come at least twice a year so that we can provide a very thorough, comprehensive exam and let them know how those oral health problems are ultimately affecting their general systemic health.
Because like a lot of things, maintenance will keep you out of trouble.
Oh, yeah. The preventive model is so much less expensive than the reactive model. I mean, I get patients all the time that come in for emergency visits, and it's like $500 to $2,000 for that visit. And
Oh, I know.
if we can prevent a lot of those things, you could be spending $100 to $300 to prevent some of those things. You know, coming in every 6 months or so.
Hey, what about that? What about this? Soft, medium, or hard toothbrush?
Soft.
Every time?
Every time.
Darn it.
Every time.
Why?
Well, let me see. What do you use?
I use a medium.
Okay. And how are your teeth? Are your gums receding in some locations?
I don't think so.
Okay. Because lots of times you can use a medium toothbrush, but we really encourage a soft toothbrush.
What about when you brush? Should you go at it?
No, I mean, when your brush starts to look like this, it's time to switch it out. But it's funny, I'll go to friends' houses and I look, I'm a dentist, so when I go to the restroom, they got their toothbrushes and they're all
ugly.
splayed out. I'm like, man, that thing, what is it doing, It's begging for help. So,
Ever since I was a kid, I brushed my teeth in the shower. Good idea?
fantastic idea.
Is it? All
That is
right.
Yeah, it's funny, I tell my patients that.
It's more cleanly.
Well, we start seeing kids at age 2, 3 years old.
It's like a water picking also.
It is. I mean, it's a full body cleanse when you're in the shower, right? Including your teeth.
Right.
Yeah.
Good gargle.
Gargle, you do what you want.
Get it all over the place. You don't care.
Yeah, spit it all over the tile.
Do you brush in the shower?
I brush and floss in the shower. Yes, I do.
Yay! I don't know too many people that do, but it makes sense because the old time soap dish that goes in the shower in the wall. Everything stands up really nicely in there. I try it. You'll like it.
It's a great idea.
Yeah.
It's a great idea. If you shower every day, at least you'll brush once a day.
There you go.
So.
All right. Now, doctor, if people want to get a hold of you, how do they do that?
They could call our office at 435-3113, or they can visit. We just got a new website, by the way. You should check it out. It's Mirelez Dental. It's Mirelez dental.com. It's fresh and new. There's a lot of more information than our prior website. We encourage you to come on in and check it out. We do have a dental implant seminar coming up.
Ooh, how exciting is that?
That's fantastic. It's great. What it is we found a lot of patients were coming into our office or calling the office with the same general questions about what are dental implants and just confused about what it is. And so we said, you know what, let's just make this a free public seminar. And we've been having them monthly, and it's amazing, what people think and what they actually come out learning from those things. And
because it's not like it used to be.
No, it's definitely it's a different day. It really is.
What does that cost? Because a lot of that stuff isn't covered by the insurance.
Yeah, dental implants are going to range anywhere from $3,000 a tooth. On up. Just depends on how many teeth you're missing. But there's different
options. Can you get a
options.
deal the more teeth?
Yeah, there is actually.
Yeah.
There is. Yeah, we do offer if you're missing multiple teeth, you don't necessarily have to put one implant per tooth. I think I sent some photos of a patient that.
Yeah, look at this one.
Yeah, so
that's Richard Keel, right?
Rest his soul.
Oh yeah. Okay.
So this was a patient.
The same mouth?
That's the same mouth. Before and after, that patient came to us, and all his teeth were literally in bad shape. And he says, you know what, I'm tired of living this way. My quality of life is severely affected. And so that's what we're here for. Is to
so did you take out all of his teeth?
In his case, a lot of his teeth were either really bad decay, so they were beyond fixing.
Even the molars?
Even the molars. You can see in that photo there, all of his lower teeth had either gum disease or cavities, and he didn't like how crowded they were. And so what we did is we ended up taking his teeth out, putting dental implants, not one per tooth. We put, I think, 6 on the top and maybe 5 on the bottom. And
because they were so smashed in before that you had room to do them and not evenly with less teeth?
Exactly. So we use anywhere from 5 to 6 implants to hold a whole arch of teeth.
It's like putting
putting
an engine back together. There's always some left over.
Right.
Yeah?
So I brought you a gift here.
Oh, nice.
Check that out. Are you serious? So,
I lost
your
one
ball
already.
fell out.
Oh my god! Good thing I didn't swallow that.
Yeah. Well, I was going to tell you, a patient just brought that to me.
What?
And I wanted to show you what old dentures used to look like.
water.
Thank goodness it has a pH of 10 right
it's
there.
It's attaching to the tooth molecule. Yeah. Dr. Mirelez, when's your next seminar?
My next seminar is April 22nd, and it's at our dental office, and it's an opportunity for patients that are interested in implants. No obligation whatsoever. It's just a matter of coming in and learning, and it's about an hour long. We provide food and beverages and 1 hour of just free education. And for those that are interested in pursuing, then we can help them. For those that are not, then hey, it was great that they have this information and they can.
You know what would be awesome is if the food that you served had those little red pills in it, like when we went to school and they made them chew it up and it showed all your cavities and everything.
We still have that.
Yeah?
We still have that.
Another story that Billy got this weekend from my mother was I told my little sisters that the aspirins were candy, but you had to chew them up.
Oh, jeez.
And yeah, lights and just horrible. Okay. All right.
Hey, well, tomorrow's April Fool's. That'll be good.
It is April. Do you have a good April Fool's joke?
Yeah, my wife, it's funny you mentioned it this morning. I thought today was April Fool's. So I told my wife after we went to the gym, I said, hey, let's go swing by the donut shop. And she said, okay. And I said, well, I'm going to put a bunch of toothpaste in all these donuts and give them to my kids. She didn't like that idea. But me being a dentist, I thought that would be hilarious if I just, it was a toothpaste-filled, jelly-filled donut. What do you think of that?
I think that's cruel and unusual. All right? Ruining a good donut like that. Probably donuts are keeping you in business a little bit.
Yeah, they do. They do.
I like the one we saw the other day with the hair dryer where you load it full of talcum powder.
Oh, that's a good one.
Yeah. So.
Somebody else told me another one this morning.
Right.
You put a lifesaver in the shower head, and they're constantly sticky for like 3 showers.
Yeah.
What do you think of that one? That's a pretty good one.
Ick.
I like that.
How about the filling your medicine cabinet full of marbles, and then the next person that checks it? Okay.
That's a good
one. Good one for a party, and you'll know who's in your stuff.
That's
All right, Dr. Mirelez, go see him. He's across the street from Bullard High School. Doctor, good to see you.
Same here, boy.
We're going to take a quick commercial break. We'll be right back on the buzz. Stick around.